All right. Imagine we're meeting for the first time. You're at home, and so am I. We arrive at this moment, though we're in different places because we're meeting through a screen, a computer screen, a frame. You've had a tough life, and you love your children and your old black lab. Miles away from town, you may live off the grid in a house that you built with your own hands, or in a trailer on the back of your parents' property, or maybe in your car, or with a friend on their couch, or at the rescue mission. Imagine for a moment that your journey to this place had nothing to do with attachment parenting, prenatal care, and the kind of privilege that mine did. Imagine that you can't even imagine the upper reaches of Maslow's hierarchy from way down at the bottom. You're sick, and you're getting sicker. Hello, my name is Michael Fratkin, Dr. Fratkin. I am a father, and a husband, and a brother, and a friend, and I'm also what's called a palliative care doctor. Now, what does that mean? Well, it means that we don't take care of any patients. We only bring care to people. It also means that I'm a part of a team of other people. Nurses, social workers, chaplains, community health workers, care coordinators. It means that we'll never see you as anything other than the person you are. It turns out that I am also a person. And the only thing that distinguishes you from your team, from us, is our current place on the timeline. Right now, you're in a place where you need to receive care. And we're in a place where we need to give care. Someday I know I'll need care too. Now, to get us started, I have a few questions. Who are you? What do you think is happening to you? What matters most to you now and going forward? These questions are my offer to enter a relationship, a frame, a stake in the ground. The questions are my invitation for us to connect and to trust. If you join me, a person, a doctor with a life, I can begin to understand how you're navigating the life that you're living. So several years ago, I had a crisis. I was angry and confused and angry as hell, and I was just about wrecked. These very sick people I'd been caring for were teaching me what they wanted and what they needed, while the industrially inspired structures of the transactional 20th century healthcare delivery system was crushing their hope and mine. Every day, under the pressures of numbers and clicks and the expectation that while the system was locked down, my hours, my time, my care was somehow limitless. I felt lost. I couldn't find a way to help sick folks achieve the best possible lives that they defined for themselves, and I definitely couldn't find that for myself, or my family, or my colleagues. All of us are suffering within a system that values transactions over relationships. Like the work itself, the only approach to managing this work is to manage it together. Up in Northern California's rural counties, the people that depend on the safety net are dispersed over a huge and rugged landscape, traveling for hours in broken cars driven by family members, taking precious time off work to see me, to help achieve a better quality of life. Well, that just seemed dumb. Then I noticed the supercomputer that Steve Jobs put in my pocket. I've never particularly loved technology, but I've always loved the people I get to care for. I couldn't keep asking people to come to me, and I couldn't keep ripping through oil pans and tires on back roads all day long. So I figured I'd try connecting to them with the amazing tools at my fingertips. I am, after all, a tool-using primate. That's it. That's the genesis of Resolution Care Network. One burned-out rural palliative care physician, a ton of unmet need, and the simple idea that consumer technology and economics that favor relationships over transactions might be useful together. Now, despite how miserable I felt, timing turned out to be pretty good. The Institute of Medicine just released their second Dying in America report. And I have to tell you, in 17 years, it really didn't get much better. Atul Gawande's Being Mortal rocketed to the top of the bestseller list and was selling like hotcakes off even the Walmart shelves. The California state legislature stepped up with SB 1004, a mandate for palliative care for all Medicaid recipients. And the California Healthcare Foundation was continuing to break trail by convening payers and providers to build partnerships to create access to palliative care in hospitals and clinics and in homes. And on the day we launched our crowdfunding campaign to build Resolution Care, a young woman with brain cancer, Brittany Menard, dug in. She used the last few months of her life to advocate for her ideas about what death with dignity meant. Brittany completed her life on the day we launched our crowdfunding campaign. So using telemedicine is pragmatic. It's just the best way to build relationships with the folks we need to reach as often as we need to reach each other. These days, our team connects directly with folks for an average of about 6 hours a month. Nearly 50% of that engagement happens through video conferencing, face-to-face, person to person, in real time. We estimate that we've saved more than 60,000 miles of driving this year. Now, here's a secret. Telemedicine is better than real life. Imagine, again, how sick you are. Imagine how far it is. Imagine how hard everything is and how you feel when they stuff you into the role of patient at the clinic. It's imposing and depersonalizing. Even if the magazines weren't 10 years old and the plants weren't wilted and the staff wasn't stressed beyond belief, it is wickedly intimidating. Even if the other people waiting next to you weren't scary sick and coughing. Even if, and imagine how you feel if some privileged healthcare professional comes knocking on your door. Even if you aren't embarrassed about the condition of your home, the smell, and the chaos, it's still a home invasion. Now, Northern California is enriched with diverse cultures, many of whom agree on one thing. Anybody coming down the driveway that they don't already know is likely someone they don't want to meet. The best possible care, defined by guidelines and randomized controlled clinical trials, can sometimes seem a million miles away from the people we work with. A 40-year-old, broken-hearted, single mother of 3, addicted, homeless, mentally ill, with cancer pain in the last few months of her life. She needs to be seen and heard before trust can lead to any medical progress. That's relationship, not transactions or compliance. Now, doctors are people too, and nurses and all the other folks that form a team to bring care. People brave enough to do this work, fragile like me, under the strain of a system they depend on. Like sick folks, clinicians walk into hospitals and get stuffed into the institutional roles imposed on them too. We are, after all, social primates. We accomplish so much more by working together to create the social structures that serve our goals rather than frustrate them. At Resolution Care, we empower our coworkers to work wherever they want. As long as we're meeting the goals of the people under our care, our team is free to be responsive to every unique unmet need. I'm wondering, do y'all have any unique needs of your own? Flexible hours and a focus on outcomes rather than time clocks give freedom for self-determination and creativity to the team. They get to work where they want, how they want, and while still being part of something bigger than themselves. Imagine that. What we're doing isn't technologically complicated or medically sophisticated, but it requires a whole lot of blue sky. Now, blue sky is simply what's happening outside the box. Unconstrained by years of committee work and layers of turf battles and politics. Imagine that instead of building organizations from the whiteboards and the boardrooms down, we're building the future from the bedside up. It's spending a little dollars to put a satellite dish on the home in the mountains to support a woman to care for her husband on the land in which he's lived his whole life and on which his people have been living for centuries. Respect for the agency and worth of all people has been embedded in the definition of palliative care and, in fact, embedded in the currently strained fabric of this American experiment. The challenge in creating the future American healthcare experience is to create value for all with improved well-being, dramatically better satisfaction, less waste, and sustainable work for those of us that care to bring care. Imagine that future. So a couple of years ago, I was called to do a consult at the hospital. A 70-year-old native man, an elder, was failing to recover from pneumonia. His 90-year-old mother, Grandma Aggie Pilgrim, sat upright at his bedside in tribal regalia. I knew of her, and it made me nervous, because Aggie had led the International Council of 13 Indigenous Grandmothers in a global effort to spread wisdom. A dozen people were in the room, at least, 5 generations. And on a bedside table, a laptop computer delivered another dozen family members from all over the country. And this pioneer of telemedicine for palliative care had nothing to do with setting it up. The family laid out a clear path forward to allow this man to complete his life peacefully. And I asked Grandma Aggie to lead us in a prayer. She lit some sage, and I tried not to worry about the smoke alarm. She spoke about her son, and about water, and about time, about how long a life is, and about how short a life is. Connected. All of his relations. No distance, together in time, with love and respect and all the room needed for grief and healing. Imagine that we're building a world that weaves that kind of wisdom into the healthcare delivery machinery. Imagine that the best of our inventions are made useful to people through relationships that can guide them as they find their way to the completion of their lives. Imagine that when you're sick, when we're sick, the society that we are creating is clever enough to engineer and sustain a world worth living in and dying from. Thank you.